This study employed a cross-sectional descriptive study design, which was appropriate for assessing the prevalence of hepatitis B virus genotypes and associated biomarkers at a specific point in time. The study was conducted over a 4-month period from December 2019 to March 2020 at the Moi Teaching and Referral Hospital Liver and Gastrointestinal Clinic in Eldoret, Western Kenya. A cross-sectional design allowed the researchers to examine existing cases of chronic hepatitis B among patients already receiving care without introducing any intervention. This approach was particularly useful for generating baseline data on genotype distribution and virological characteristics in a real-world clinical setting. The study population consisted of patients with confirmed chronic hepatitis B infection. From an initial group of HBV-positive patients attending the clinic, 43 individuals met the eligibility criteria and were included in the final analysis. These participants represented a census of all eligible patients during the study period rather than a sampled subset, thereby strengthening the representativeness of the findings within this clinical population. Eligibility was limited to adult patients aged 18 years and above, ensuring that all participants were legally able to provide informed consent and that the findings reflected adult patterns of chronic HBV infection. In addition, all participants were required to have a history of HBsAg positivity for more than 6 months. This criterion was essential for confirming chronic infection as opposed to acute or recently acquired hepatitis B. By focusing on patients with established chronic hepatitis B, the study ensured that the observed genotypes and biomarkers reflected long-term viral persistence and ongoing disease processes. This was particularly important for evaluating biomarkers such as HBV DNA viral load and HBeAg status, which can fluctuate during acute infection but are more stable and clinically meaningful in chronic disease. In summary, this cross-sectional descriptive study, conducted between December 2019 and March 2020, involved 43 adult patients with confirmed chronic hepatitis B infection. The clearly defined inclusion criteria allowed for an accurate assessment of HBV genotype prevalence and associated biomarkers among patients attending the MTRH liver clinic, providing valuable insight into the local epidemiology of chronic hepatitis B.